Dr. Hillary Frederickson.
Hi, honey. How you doing? Happy Monday.
Yeah, I have been engrossed with this topic. I just sort of cannot believe that we used to be worried about food additives because they were preservatives and made us gain weight. And there were food dyes that may affect our nervous system and all these other reasons. And now we have a whole other set of worries, which is food additives bothering our microbiome. So that's what we're talking about today. Another worry for you all, but it's very easy to avoid.
All the worries. All right.
But it's
So
real, right? It's really you and I have really noticed this over the last few years that people's GI systems are just under assault and we're just so confused because many of the patients are very good eaters, this, that, the other thing, but maybe some of these gluten-free products and dairy-free products and just more and more products in the market are having these additives that are now having data to show they're disrupting our really important bacteria lining our GI system, which help us create nutrients, absorb nutrients, metabolize our food, controls our metabolism in a lot of ways, our hormone metabolism, our weight, our brain health, our happiness, depression, anxiety, all that we think are really linked to disruptions in the gut microbiome.
it's such an exciting time in medicine. Like we're learning so much. It's so awesome. And we're going to really have to look with a fine tooth comb and a microscope at all the stuff that we're exposed to regularly that's damaging this like super crucial part of our ecosystem.
I
Right.
know. And it's just unbelievable because it's people trying to do a good job. They got off the half and half in their coffee and now they're using some oat milk creamer or almond milk or cashew creamer and they think they're doing a good job, but they're noticing gas, bloating, weight gain. Oh, I'm so much more depressed than usual, all these things. And it could be some of these food additives in there.
I know I'm like looking right now at what I use and I've stopped using it because of the additives. But
Mhm.
I use a company that like was, I'm just trying to look to see what's in
So
there. Anyway,
today, the topic for today is guar gum. So
yeah.
the food additive to consider avoiding if you're trying to work on your gut is guar gum because we're really seeing more and more evidence come out about this. It's a thickening agent. So that's why I was talking about the half and half. I find that when people go dairy free, after all these years of working with people, it seems to be the half and half in the coffee in the morning that's like almost the hardest.
It's
After that,
definitely,
it's cheese, cheese in the salad, cheese and, as a protein source. So when you're working on protein a lot. But it's not usually, oh, just my milk and my cereal. That's not what I hear from people. The hardest thing is the half and half in their coffee. And so these alternative creamers have blown up. The industry is really big here. And I was looking at some research. This was a mouse study that was funded by the Crohn and Colitis Foundation. So these, bigger groups of people with inflammatory bowel disease are noticing these foods really flare me up and cause problems. And after their research, which was really recent 2 years ago, they concluded, and I'm going to read this to you, Hillary, because this is really saying it, right? Collectively, our study demonstrates that food additive guar gum adversely impacts the gut microbiota activity and colonic immune response and increases susceptibility to colonic inflammation. So we go back to inflammation in our guts for everything. You could be having a rash, you could be having headaches, you could be having mood problems, you could be having so many different effects from inflammation in your gut lining. It's a pretty serious thing.
but you guys, this just comes down to processed foods and we all
Mhm.
fall into it. Like it's the falling into the, oh, there's a better alternative for the food that gives me,
Mhm.
especially dairy. And I fell prey to it too, like that I'm going to use this product that's got some sort of coconut cream and almond cream and a stabilizing gum. That now there are people who are now recognizing that the gums are bad, and so there's milks that non-dairy milks that don't include the gums. But I feel like it's a little bit like whack-a-mole, like we're just chasing, chasing, chasing. And at the end of the day, when
Mhm.
we put people on a detox or on a program where they stop eating processed foods, and they go back to eating just mostly all natural foods. You know where it comes from. Even if it's like coconut milk, I'd rather transition people just to straight up coconut milk where you can see it. It's where and all the great, amazing, healthy vegan millennials that are on Instagram are like using their coconuts. There was a phase in life where I like got the fresh young coconut and I made my own coconut
Mhm.
milk during the day, like the raw foodies do. And I can't do that right now in my life, but we have to like get back to where we know exactly where the food comes from.
Mhm.
Last night I made dinner. I made like potatoes, broccoli, cauliflower, a gorgeous salad that had 3 different greens in it, purple cabbage, strawberries. I'm trying to get my 40 foods in. And then I made pork tenderloin and I'm sorry, I know that you're struggling with that right now, but was from all organic sourced, and it was marinated in mustard and a little bit of maple syrup. And then I made a reduction of it with shallots and garlic and some other things. It's all food that you
Mhm.
can track. You know where it came from. Most of it
Mhm.
came from the ground or it came from an animal. Like there was nothing else in the meal. And it's such a bright, beautiful, easy meal to prepare. And it just shows the power of like not eating anything processed. And we
That's
all
true.
had beautiful plates of colors, and it's just where we get stuck is when we're going to the box and we're going to the bag
Mhm.
and we're going to the this, and the food industry is not looking out for your health.
Mm-mm. No,
Okay.
and then you see like more and more of these issues as far as it's just constant, once because we've been looking at ingredients for a really long time, you and I, and you see these patterns, and then it becomes a problem. So one ingredient comes in and then it's in this food and that food and the other food. So it's really important to always check the labels because you just don't know when they change their formula. So when we're buying the alternative milks, we're just looking for the nut or whatever it is, whether it's flax and water. And there can be salt in there. Okay, fine. But that's it. There doesn't need to be all the rest of this. And there are natural thickening agents that are seaweeds that have been used for thousands of years as far as culinary delights, that we can use, but we don't need it in the things, especially that we consume daily. So it's
That's what it is, right? It's
right.
the everyday use instead of just getting it a little bit here, a little bit there. It's the everyday use. And it is you and I have both made really delicious coffees at my house with the alternative that I use that I love. It's not sweet, but it thickens up in a way that it's not normal compared to like if I use half and half or milk. And I'm not dairy sensitive, so I can use those things, and it's always like getting back to just, oh yeah, okay, we just need to get back to basics. But I would even rather people use, like I said, coconut milk, like just straight up plain old coconut milk. You can open it from a non-BPA lined can, pour it into a glass jar, keep it in the glass jar in your refrigerator, use it and froth with it. And then it's different. Coconut milk has definitely a very specific taste. So people in their coffee get triggered. And it's so funny how much we are trying to work around patients and their coffee.
It is. It's like a real thing. It's
It
the way
is.
we start our day in the States. And I always like to say, coffee is the largest source of flavonoids in the American diet. So coffee is not all bad for you. It does have antioxidants in it because guess what? It's from a plant. So we can get some benefits from coffee, and we have great research on brain, dementia, Alzheimer's, those things. And drinking coffee may help prevent some of those memory problems, which is something I'm certainly trying to prevent. We run into issues with coffee when we're dealing with people with anxiety and sleep issues and things like that. And we do worry about how detoxing the caffeine as we get older becomes potentially a problem for a lot of people. But other than that, if it's not sort of that evil thing that we learned in school. I remember that we learned in school, you're going to remember this comment, Hillary, that coffee strip mines all your minerals in your body. Now part of that is somewhat true, but it's so dramatic, right? Strip mines. But we have to remember that
yelled at. Do you remember I got yelled at in the cafeteria when I was pregnant at school, at naturopathic medical school? I got by a fellow student for drinking coffee because I was pregnant. And it was like, you guys have to, you guys might not know this, but Dr. Kara and I studied 2 programs when we were at Bastyr University. One was the naturopathic medical program, which was like a beast in and of itself. And then we both studied Chinese medicine and got a master's in acupuncture. And so our days were like hilarious. It was like from 6 to 8 we would start at 8 a.m. doing like Tai Chi out in the thing. And we sometimes had it at 7 in the morning. So we're like fitting in all the Chinese medicine classes in the other program. And then we would be doing Qigong at night. And Qigong is an amazing for acupuncturists, for anybody, it's an amazing practice. And we were taught by this amazing man named Boon Chai, who was so fascinating from China. We had such incredible teachers, but we couldn't stay awake. Right. And I remember I was pregnant and I was just like so tired, and I don't really have negative responses to coffee. And there is research that a small amount of caffeine's fine in pregnancy. And kind of my situation was like, well, my daughter's just going to have to be used to coffee because I have to get myself through freaking Qigong at 6 to 8 p.m. where I'm like, it was 8 to 10 p.m. It
was 8 to 10 p.m.
10 p.m. It's so outrageous.
We were very calm at 10 p.m. when we left, and then we had to start studying. But it was dark when we went in there. It was kind of lovely, and it was an amazing experience and would fit in my life right now very well, but it was hard at the time.
Oh my God. And I just remember this woman was like, you are going to make it so your baby has ADD, and you're going to make it so da 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 da. And she really went off on me, and it scared me, and enough to drive me to read research. And I was just like, I'm fine. I can have my 1 cup of coffee so that I can stay awake for the freaking Boon Chai, for the so that I can feel my power chi ball and be pregnant and get through it.
Yeah, it's so funny. Somebody's saying you writing into us how we did Qigong for 2 hours. Yes, it was awesome. It was so wonderful because in our school, they really taught this concept of doctor heal thyself. And that was kind of something we went through a lot on. And it was sort of do the lab tests on yourself, do the diet on yourself, do the detox on yourself, do it all on yourself. Because how are you supposed to teach other people if, you don't make all those? We love to make all the mistakes and then share them with all of you. Because we've made all the mistakes, the health mistakes.
I think my biggest mistake, and then we'll get back to the Guar Gum, but was when I got really fired up. I got sick. I rarely get sick, but then I was really fired up. We just had an essential oil class, I think, or something. And I got super fired up about, the antimicrobial power of the essential oils, blah, blah, blah. And I made a steam inhalation with thyme oil. Thyme oil, if you guys have never used it, is the strongest, most intense. And we had microbiology lab where we had all these different, we were testing the antimicrobials, augmentin, amoxicillin, doxycycline against essential oils for these bacterial cultures, and the essential oils would always win. I mean, they would crush. And so I was so fired up to do the thyme oil, and just like me, so overzealous. I think I was shake, 10 drops of the thyme oil in the steam inhalation. And I put my towel down and the water is steaming and I can smell the whole house. My whole bathroom smells like thyme. And I put it down and I take my first inhale, and I singed the complete shit out of my nose, but then I burnt off my eyelashes, and my eyes were red for 2 or 3 days. I just burned myself. Fully. It wasn't the steam, it was the time. So now my poor patients, I'm like, okay, you guys need to use 1 drop and close your eyes and don't. I say it so many times, and they're like, okay, we got it. I'm like, no, you really don't understand.
Yeah, learn from our mistakes. So this is one of the other things is that it's sort of, we always come back to this idea of, the natural state of something is better than when we try to augment it. It really is. So these whole herbs are better as a whole herb, or better as, we always are learning this when you super concentrate one herbal component. it causes problems. There's something that in the thousands of years of people using the herbs, the form they used should be the one we probably go to first, right? And not try and, make it better or extract this one thing and super concentrate it and then add this other one. So we just learn these lessons over and over again. And, I just want to say about the caffeine real fast, that if you are suffering from, if you have had miscarriages, avoiding the caffeine is probably a good idea there. Hillary was further along in pregnancy and a little increased heart rate for her, developing fetus was going to be okay. So
for me, it was a trade-off that I fully made, but it's not what I recommend for patients for sure. But I will also say about caffeine is that so much of it has to do with how you detox. Right. And one thing I will say that I see all the time happen with my patients in medicine is that they go for sleep insomnia. They get put on trazodone. They get put on sleep aids, sometimes Ambien. Ambien seems to be falling out of favor but trazodone is right up in there, sometimes gabapentin. And they're drinking 3 or 4 cups of coffee in the morning. And it's just like, wait, how can we put you on a sleep aid if we don't even address the thing that's eventually that's the issue? And it changes as we age, just straight up point blank, like what you could handle. It's like, I used to be able to pre-party with a bottle of champagne in college and while I was getting ready and be fine, maybe not fine. But if I did that now, I would like have so many hot flashes and I would be so sick. So like it changes as we age, people.
And because alcohol and caffeine go through those liver detox pathways and it just changes. It absolutely does. So we're talking about caffeine quite a lot because we're getting comments about this as people are watching. And so back to the Guar Gum, just as the end of this is that
we got to the caffeine because we used the Guar Gum to make our coffee taste better when we're trying to avoid dairy.
Right. And this is where people are going to find it most in their house. There are alternatives to dairy products. But I want to say about the Guar Gum too. I had a patient who was having real GI issues and we could not track it down, losing weight, all kinds of problems. And she also had really severe anxiety. But we did a test that tested all her sensitivities to food additives and it came back. And I had such a hard time finding her a toothpaste that didn't have it in it. So it is showing up in all these different places. And I swear, I know this sounds really dramatic, but for her, that in her toothpaste was causing her real problems. So it really was. So it can be, she was obviously very sensitive and her gut microbiome was obviously in a precarious state that could affect it in such a degree. But it is the same lining up our noses, in our mouth, all the way down our throats. The lungs have the same kind of tissue, GI, urinary bladder, your reproductive. It's all sort of the same kind of mucous membrane tissue. And so anything that can disrupt the bacteria there and shift it in such a way that inflammation is potentially could be causing you real underlying issues. And the way we got to this, right, Hillary, is because we did all these food sensitivity tests on a group that we were working with. And we're going through like the 60 something tests and we saw that everyone was having problems we did not expect. And we think one of these causes may be these food additives. That's why we're here talking to you today.
So we are seeing a significant uptick in leaky gut syndrome, in gut issues, in inflammatory bowel disease, in just SIBO and other bacterial issues in the gut. And I mean, it's just my patient days are pretty much filled with it.
Right.
And I'm seeing a lot of teenagers with issues. So there's just, and these Guar Gums, interestingly enough, are also in shampoos. They're also in body products. So we are getting a lot of these things that shift our microbiome without us even knowing or thinking about it. So that's all. It's time, just like get back to nature, everybody. Look at your plate of food and know where it came from. If you're eating mostly foods that you can look and say it was grown here, it was from here, it was done this way, then you're going to have so many less issues than if you're eating from the processed food section.
One of the best pieces of advice that I'm giving everyone these days is go to the farmer's market weekly. It's summertime. It's so inspirational. It's incredible what's out there. It tastes so much better than if you get it at the grocery store because it's picked when it's ripe. Go get
You're
inspired.
supporting local farmers that are really trying to work on soil regeneration and are part of the fabric of saving our planet, really. So eating organic from local farmers is a huge deal.
Okay, next time we're going to do the third ingredient to potentially avoid if you're looking to help your gut.
You guys, and just so you know, if you want to check on your microbiome and see if you have some of these inflammatory markers from dysbiosis, then click, we've got a way to help you do that. So follow up with us if you are interested.
Bye, everybody.